I just got this book here, The Unreported Truths about COVID-19 and lockdown. This guy, Alec Berenson, is a New York Times reporter. And he calls it, he says the numbers are so fake, they can't believe it.
There are good reasons for skepticism today. David Spiegelhalter, author of last year's The Art of Statistics, laments some of the UK government's coronavirus graphs and testing targets as number theater, with dreadful, awful deployment of numbers as a political performance.
Trump never wears a mask, and Biden always wears a mask. That's what it comes down to.
From the point of view of statistics, we seem to be standing at another fork in the road. The disinformation is still out there, as the public understanding of COVID-19 has been muddied by conspiracy theorists, trolls, and government spin doctors. Yet the information is out there too. But while we can use statistics to calculate risks and highlight dangers, it is all too easy to fail to ask the question, where do these numbers come from? By that, I don't mean the now standard request to cite sources. I mean the deeper origin of the data.
But I think the pandemic, the numbers are fake, and they just jack the numbers up. The real pandemic is fear, and it's more control over us.
On Friday, Elon Musk said that in one day, he took 4 COVID-19 tests and received 2 negative and 2 positive results. He also tweeted that he took 2 PCR tests at separate labs and is waiting for the results. Musk, who has been dismissive about COVID-19 and its severity, tweeted that something extremely bogus was going on. Musk has been a critic of COVID-19 testing in the past, suggesting anyone who tests positive should retest. Back in June, he tweeted, "There are a ridiculous number of false positive C-19 tests, in some cases around 50%. False positives scale linearly with number of tests. This is a big part of why C-19 positive tests are going up while hospitalizations and mortality are declining. Anyone who tests positive should retest." The truth is, no test is 100% accurate all of the time, but Musk's experience still begs questions. What are antigen and PCR tests? How accurate are they?
These tests, we're all taking them. Are they accurate?
Well, Shep, they're not perfect, and they do come with the risk of false positives and false negatives, being told you've either got COVID when you don't, or that you're free and clear when you're actually not.
Rapid antigen tests require a nasal sample that can be collected at home or by a healthcare provider. They work by identifying specific proteins that are found on the surface of the novel coronavirus when someone is infected with COVID-19. The sensitivity rate, or how effective a test is in identifying people with antigens, is between 84 and 98%. According to the Food and Drug Administration, positive results from antigen tests are highly accurate, but there is a higher chance of false negatives. In particular, Musk said he took rapid antigen tests from BD, Becton Dixon and Company. While Musk's very small sample of 4 tests clearly only got the result right 50% of the time, in BD clinical studies, the tests achieved an 84% sensitivity rate. For a PCR test, a healthcare provider will stick a long swab up your nostril to collect a fluid sample from the part of your throat behind the nose. These tests are designed to look for genetic material of the virus that causes COVID-19. PCR tests have a sensitivity rate of 95%. False positive results from a PCR test are unlikely, according to the CDC. This is because the genetic material from the virus that causes COVID-19 cannot be confused with the genetic material from other viruses, according to MIT Medical.
New government guidance is raising doubt about the accuracy of coronavirus antibody tests. The CDC says the tests used to determine if people have been infected in the past could be wrong up to half the time.
There is this confusion about COVID-19 infections versus cases. In epidemiological terms, a case is a person who is diagnosed with COVID-19, mostly by a positive test result. But there are many more infections than cases. Some infections don't show symptoms, Some symptoms are so minor, people think it's just a cold. Testing is not always available to everyone who needs it, and testing does not pick up all infections. Infections cause cases. Testing discovers cases. Donald Trump was close to the truth when he said the number of cases in the US was high because of the high rate of testing, but he and others still got it totally wrong. More testing does not result in more cases. It allows for a more accurate estimate of the true number of cases. The best strategy, epidemiologically, is not to test less, but to test as widely as possible, minimizing the discrepancy between cases and overall infections. Countries and even states may count cases and deaths differently. It also takes time to gather the data, meaning retrospective adjustments are made. We'll only know the true figures for this pandemic in retrospect. Equally so, early models were not necessarily wrong because the modelers were deceitful, but because they had insufficient data to work from.
If you liked the video, a sub to the channel would be incredible, and also share the video to spread the word. You can watch another video, just click left or right. Keep inspiring.